Hello, and welcome to the Functional Nurse Academy podcast. This is your host, Melissa Schreibfetter, owner and founder of the Functional Nurse Academy. Hello. Welcome, everyone. As always, it is just wonderful to be here with you guys today and to be able to just spread the word of holistic health and functional medicine and all of the great work that nurses are doing across the country. I am joined by another Functional Nurse Academy graduate today. Cassidee Weaver is a registered nurse and board-certified functional medicine practitioner with over 15 years of healthcare experience, including many years serving patients at the VA hospital in Phoenix, Arizona. Through both clinical practice and her own healing journey, she developed a passion for addressing root causes and providing individualized, whole body care through functional medicine. She is the founder of Cassidee Weaver Functional Wellness, where she focuses on nutrition, natural therapies, advanced testing, and patient education. She is currently completing her family nurse practitioner degree. Cassidee is passionate about bridging conventional and functional medicine. She is also a wife, mother of three, and follower of Jesus. Welcome, Cassidee.
Hi, thank you.
So I was reading your bio, and then, we were talking before we started recording about how we both have three children around the same age. And I was reading your bio, and I was like, how is she also in school to be a nurse practitioner? How are you doing this all with three kiddos?
Well, quite honestly, I took a break from the nurse practitioner program and I've been going through this battle, I think, with God, trying to figure out what exactly I'm trying to do. Um, I know for sure I wanted to do functional medicine, which is when I found your program and I started to do that, finished that, and then I was going to do my doctorate's degree. But then I changed my mind again. It was more like a nudge from God, like, "Hey, you already finished half of the FNP program. You need to finish the rest." Because all I have left to do is clinical rotations. So, my husband works from home, and he's been, like, a huge support system for me, and he's like, "You should just do it. You should just do it." And my mom lives down the street, so that's super helpful. But I don't know. My family calls me a robot. I think that it's really just that drive that God gives us, to support the family and provide the care that I want to my clients.
Yes, yes. And I also can sympathize because I have that drive that like get it done, I'm like
Mhm.
always busy, busy, busy. But what is so great about functional medicine, especially and even if you do finish, your NP, of course, we all know that really, really expands legal scope of practice. But in the meantime, it's nice that you can still have a functional medicine business
Yeah.
as a registered nurse, which I really, really love to spread the word about that because again, there's so much we can do within scope as registered nurses. And so I know that you had an interesting story. I feel like all the nurses I have on here, every story is so different. And your story involving your pregnancy, I found really interesting because, again, I mean, I just past couple of years, I just feel like I'm constantly pregnant. And I feel like so many of these pregnant women, they, we just become so distrustful because there's so much bad medical advice and it's hard to trust what your providers are saying because there's so much mixed medical recommendations, especially for pregnant women. So, would love to hear your story about how you became interested in functional medicine.
So, I was pregnant with my third baby, and somewhere around 6 months, I developed this weird rash on my thigh, and it really came out of nowhere, and it just kept disappearing and reappearing in different areas, and then it just started spreading everywhere. So I went to my OB a couple times and they wanted me to take steroids. And then they told me to go to a dermatologist. So I went to two different dermatologists. They had no idea what was wrong with me. Nobody could figure out what was wrong with me. I went to an allergist, and my allergist told me that I needed to take 5 Zyrtec a day for the rest of my life. And I left that appointment because during that appointment, I actually demanded to be tested for MCAS. I was certain that I had mast cell activation syndrome, because also during my pregnancy, I was dealing with a lot of stress. So I figured, hey, maybe this triggered it because I have had a lot of allergy issues. But he wouldn't do it. He just told me to take Zyrtec. So I went home and I was like, I'm not doing that. And I started researching and I put myself on an anti-inflammatory and an antihistamine diet, very strict. And my rash disappeared in 3 days and it never came back.
So that is so interesting. And I hear these stories time and time again. And you would think that, especially when we're talking about pregnant women, that prescribing a pharmaceutical, especially such as Zyrtec, and I have this handy dandy package insert pulled up right in front of me because I remember when I used to be a psych nurse. I remember an adolescent boy was admitted because he went into psychosis after being given Zyrtec. And this is a medication with extremely serious side effects. And per the package insert, when it comes to psychiatric events that may occur, abnormal thinking, agitation, amnesia, anxiety, depersonalization, depression, emotional instability, euphoria, impaired concentration, insomnia, nervousness, paranoia, sleep disorders. When the physician told you to take 5 Zyrtec per day, did he describe any of those side effects to you?
Nope.
And also there's so many medications, and again, it's just not ethical to be like, "Well, we're just gonna do a trial on this medication for pregnant women to see how they do." So again, these medications are not tested with in pregnant women, but then again, it's on the market and they're like, "Well, let's just see if pregnant women can take it." Oh, yeah, you're fine. So, there's so many medications that they tell us are safe in pregnancy that
Mhm.
may not actually be safe in pregnancy. So, did you end up going back to the doctor and being like, "Oh, I fixed it in 3 days." Like, were they aware of your progress?
I did tell my OB because obviously I had to go back, but I did tell them, and thankfully, one of the OB doctors that I saw, because I go to this a clinic that has midwives, so it's OB doctors and midwives. So, the doctor that I saw, she is really holistic minded also. Um, so she believed it. She was impressed, but she was like, I totally believe it because I believe in that stuff too. But nothing really ever happened after that. So,
And do you think that after going through that, do you think that it was mast cell activation syndrome?
it's hard to tell because they wouldn't test me. And at that
Mhm.
time, I had health insurance. And can I just tell you that after going through all of these things, after going through your program, after learning so many things about just the medical world, we actually canceled our health insurance too because I've studied a lot about health insurance and we just decided against it because I feel like that's a huge barrier to our health also is health insurance. We now I can go see whoever I want whenever I want. And health insurance doesn't cover functional medicine anyway. So we kind of dropped it. That was part of my journey in this whole functional medicine world. which has been quite a blessing.
So it's so interesting because, insurance companies, they make more money the sicker that we are, and that is through the premiums and other things. And another thing that's interesting about, that entire system is, so functional medicine has actually been proven to reduce overall healthcare costs and improve patient outcomes. But insurance companies are like, no, 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 we're not going to cover that, you know? And so we did the same thing because my husband recently left his job and he is on board with the business now, which is amazing to have, that extra help. But anyway, we were on insurance with the company that he worked for, and I think we paid 200 a month, and then the company was paying $600 a month. And they didn't pay for anything, And, like, I have to take thyroid medicine because I was,
Yep.
undiagnosed Hashimoto's for a decade. I could not get my thyroid medicine covered because they would only cover the crappiest, like, worst thyroid medicine you can get that I can't take and I will not take. So we had to pay out of pocket even for that. And I'm curious, what model did you decide to go with as an alternative to your health insurance?
Actually, I looked into a bunch of different things, mostly Christian based because we're a very Christian family. But even with those programs, I wasn't really on board. They're very expensive still, and I understood the concept of them. However, the situation that we're in, we just financially couldn't afford it. When I quit my job, we took a like $80,000 a year pay cut, and my husband doesn't make very much. So raising a family and trying to take care of all of us on his income was nearly impossible. So we went through some hardship and I did research it, but at the end of the day, our kids are very healthy. We're pretty healthy. I think of all the people, I probably have the most problems because I was born with Arnold Chiari malformation. So I get a lot of headaches and migraines and all the stuff that comes with it. But I've managed it really well with diet, and we've changed a lot of things in our household. So, we didn't actually end up doing an alternative. So now what we do if we need to go somewhere is call around and see what the best rate is for cash pay.
Yeah, yeah. I was shocked when I learned the differences between cash pay, and we decided we actually are doing a program called Crowd Health. It's like a health share, but they actually encourage the use of functional medicine because they want their members to get healthier. So, but anyway, I did want to circle back when you were talking about your husband. It reminded me that my husband tells me, he's like, you need to make sure you explain things on your show for the non medical people listening. So I wanted to circle back around to mast cell activation syndrome. So, mast cells are actually immune cells. Those are the immune cells that are like involved in allergy responses, also inflammatory responses, and how they help to defend you against pathogens. But in mast cell activation syndrome, it's like mast cells gone wild. And that's when they can start, releasing excessive amounts of like inflammatory chemicals. And then one of those inflammatory chemicals is histamine. So that's why some of these people might be dealing with these rashes and chronic fatigue and like itchiness and just overall feeling unwell. But I do wonder, when women are pregnant, especially if there's an underlying health condition, we have immune system shifts in pregnancy. So if
Yep.
you have an underlying inflammatory or immune condition, that can flare. But I do wonder if you had some mast cell activation that was triggered, by pregnancy and then just getting your diet under control calmed it down enough. But I think that that is really amazing that it took 3 days
Yeah.
for you to resolve this situation. So,
Yeah.
yeah,
And
yeah,
I will say that being in the modern medicine world, when I first started doing these things, I was skeptical. I'm not gonna lie, like, I had a lot of skepticism. I was like, "I don't know if this is really gonna work, but I'm gonna try it." But literally every single time that I've tried something, whether it be for myself or for a friend or for a family member, it has worked. So, uh, that's why I have completely transitioned to functional medicine, and the only reason why I'm doing the nurse practitioner program is so that I have the ability to titrate people off of their medications into functional medicine.
Wonderful. That's so amazing. Because we really, there are so many people that are on so much medication. And I've seen cases. I had one young woman that came to me. She's so incredibly kind, but she was in her 20s and her provider had her on, it was like, I think over 15 medications. And when I first started seeing her, I of course, I'm assessing your lifestyle, your diet. And pretty much all of her dietary intake was processed food, because again, I mean, I know before I went all holistic, I did think that my Triscuits and my hummus with all that industrial seed oil, I thought that that was a health food. And, I would have like organic frozen waffles in the morning, and I was like, oh, it's organic, it's healthy, And
Yeah.
people just there's so much greenwashing, but I remember I was like, how did they put this young woman on so many medications? And I remember I had referred her to like a holistically minded PCP that that wanted to help her get off of those medications because it can
Yeah.
cause so many complications for people. And and I do think that polypharmacy is just such an issue
Yeah.
in our country. And before you went functional, what kind of nursing were you doing?
I actually worked, at the VA. I worked in the spinal cord clinic.
Mhm.
So, but, the VA works very differently, so I would work pretty much everywhere, in the psych unit, and the cardiac unit, and the cancer unit. Didn't really matter if they needed help somewhere else, that's where I went. But I was primarily spinal cord, um, until COVID hit, and then we were primarily step down COVID. So I was in, like, the trenches during that time, and that is when I quit. Um, because not because it was hard, nursing in general is hard, taking care of people in general is hard, no matter where you're at, but the things that I saw, I think, ethically just were going to tear me apart if I stayed.
Yeah. So that is literally how Functional Nurse Academy was born because there were so many nurses that were in your situation because there was the healthcare industry went completely insane, like, just off the chains during COVID. I've never seen anything like it, and I there's so many nurses getting fired because of the stupid COVID vaccine mandates, and then the protocols were just a bunch of nonsense, and yet the good nurses are not gonna tolerate that? So I was hearing from nurses that were like, "Okay, I am leaving, and I need to do something else." But it's really I mean, it's scary what happened, and I remember in nursing school, they always taught us to be critical thinkers, and they also taught us that we don't want to be the first one taking a brand new product. What do you think about, the kind of things of, like, how we were trained as nurses and then what happened during COVID?
Yeah, I kinda had this conversation with my husband recently that it's aggravating for me, yet humbling because of the things that I learned in nursing. It's not that I don't believe in modern medicine because I do to a certain extent, but I also believe that there are preventive measures that we can take, which is not taught in nursing school. It's not taught in medical school, and it's very aggravating, especially when you learn about it. Because I didn't know, obviously, because I learned all the pharmaceutical stuff. I learned all of the modern medicine work, and nothing was functional medicine. We had like a tiny little nutrition class, and that was it. So it's like humbling for me because during COVID, it was like they told us you can only wear an N95 in the room once, but when COVID started, we were allowed to wear an N95 for a week long in everybody's room. So we were using our N95s in every single room, um, which was very confusing because it's like the CDC is so quick to change their rules for certain circumstances, but then it puts us at risk in a sense.
So when COVID hit, I already had my functional medicine business, but I was the like crunchy nursing instructor and I loved teaching nurses. So, which is so suitable that I ended up like starting a functional nursing academy, but I was still in the hospital about 1 day a week teaching. And I couldn't believe it because I would do those some of the classes I would teach were the, foundations where we would be teaching them how to properly use PPE, personal protective equipment, where we were teaching them how to properly put on a mask and things like that, and then COVID hit, and it's like, "Oh, yeah, you can wear that, filthy mask that you've been wearing for 2 weeks. You can wear that when you go to the bathroom. Yeah, yeah, do that. Wear that filthy mask into the bathroom and then go in there and, use that same PPE just like all of the patient rooms." I mean, it was so absurd, and I remember my nursing students were wearing visibly soiled N95s because they were all given like one
Yep.
N95 mask to wear for the entire semester. And I would go buy like N95 masks to give them clean ones. And yeah, I mean, I remember in the break room one time, um, I went into the break room and there's this like nurse sitting in there. And I went in there, she was like, "Oh, well, you're here now, so I guess I need to leave because not more than one person is allowed in the break room." But I would see like other staff sitting in the break room, eating donuts with their mask on. And it was like living in the Twilight Zone, you know?
Yeah.
So
Yeah.
you can't make it up.
No, no, you can't. It was definitely a bizarre experience. And people would ask me like, why would you leave such a good job? It's the federal government. I was already there for 15 years. But honestly, like, in my opinion, God was leading me somewhere else, and that's far more important than anything that the federal government can provide for me. And I knew that God would find me a way, so I'm
Yeah.
here.
I felt the same way. Like it definitely for me, I also felt like it was a calling. It was a
Yep,
God thing. I mean, I got really sick myself and I feel like I don't feel like all of those bad things. I don't feel like, oh, that happened to me. It was so bad. I feel like it happened for me. So that way I can now use that experience to help so many other people and then have a business that brings glory to God. But but yeah, like it really we cannot I think there's so many people that have jobs that may pay really, really well, but I mean, is it worth what it is doing to your soul if you are being required to follow through with protocols that you don't agree with and that you think are harming patients? So,
right.
kudos to you for like taking that leap and getting out of there and then doing something that really stepping into your calling. Well, we are about halfway through the show, so we're going to cut to break, and when we come back, I would love to hear about your business and like success stories that you're having and things like that. So I do want to remind our listeners, if you are a nurse and you are listening to this show and you are fed up with the sick care system, I can help you. Functional Nurse Academy is the most comprehensive functional nurse training program on the market. All of our graduates receive 90 nursing CEs, business mentorship, and they also receive eligibility for multiple board certification pathways. So you can check that out at functionalnurseacademy.com. I also will drop the link to my next informational webinar in the show notes. I do want to pause for a moment to remind our listeners. This show is also syndicated on America Out Loud Talk Radio, on the Nurses Report radio show and podcast. So you can also find me there on any major app. Hello and welcome back. I am joined today by Cassidee Weaver, who is a Functional Nurse Academy graduate, and she is the founder of Cassidee Weaver Functional Wellness. And we're talking about her journey from leaving the conventional system as a registered nurse to starting her own business. Welcome back, Cassidee.
Thank you.
So I know we were just talking about all of, those the COVID shenanigans and how I really feel like it's like a silver lining because I
Yeah.
mean, we have so many nurses now that are operating these, private, like concierge style businesses and are actually really making an impact and getting people healthy enough to where they don't have to go use the hospital system. And again, like I know we both were talking about how, yes, of course, we need conventional medicine. Of course, we need emergency medicine and the ICU unit and things like this. But the chronic disease epidemic in our country, I mean, it's completely out of control. Over 70% of chronic diseases are lifestyle and nutrition based. So why would healthcare professionals not be trained in that? So I really love what you are doing with your business. And can you tell me, I would love to hear a success story about somebody that you were able to help.
Um, I think that my one of my favorite success stories is my mom, believe it or not, because she is partially one of the reasons why I'm doing what I'm doing now. Um, she was having issues walking for a long time, and she was told that she had osteoarthritis and a torn meniscus in her right knee. So they were telling her that she needed to have surgery. But then they were telling her that if she had surgery, she was going to have surgery again because she has osteoarthritis and torn meniscus happens all the time. So she was like, "Well, I'm not doing that. That's silly." So then she came to me and she was like, "Hey, I need you to make me something because I had just gotten my nurse herbalism certification and I was kind of just making things at home with herbs and so I put something together. I researched a bunch of different herbs and a bunch of different oils to combine to make like a massive anti-inflammatory salve. So I made her a salve and I called it Overcomer because all of my products are Christian based and they all have Bible verses on them. And she used that salve multiple times a day and within about a week, she was able to start walking again. And to this day, she's been using it for about a year and a half now, and she promotes it to everybody. Um, she's been using it and she's had no issues with her knee since she's been using it. On top of the salve, I did have her taking, I also made some oregano that I had her use. She took it by mouth and she put it on her skin also, because she had a rash just below her knee that looked like cellulitis. And she started using it for that too, and it went away in a couple of days. So just the use of like my homemade herbal supplements was kind of like the start of where I'm at today. Um, and I went through a couple of different things, but your program was like by far the best that I've experienced simply because you're so in depth and detailed about everything. I mean, still to this day, even after finishing in January, I go back and look at all of your stuff because there's so much information and I feel like I still don't know everything because I don't feel like I'll ever know anything everything about what we're doing, but you just jam pack everything it's just amazing. So,
Oh, thank you for saying that, and I always say, I'm like, my worst nightmare in business is to like, it's somebody to give me money and then they're not happy. So that's why I am always like updating things, like adding new material. Cause again, I mean, I remember when I was a nursing instructor, I knew the most dangerous student I had on the unit was a student that thought that they knew everything. And again, like I think that God's creation is so complex. And he did put things on this earth like herbs that can actually heal the body, and so much there's so much evidence coming out and confirming things we know from the Bible. I mean, the herbs are referenced in the Bible, like it was, I actually have it pulled up. Revelation 22 2, the leaves of the tree were for the healing of the nations. I mean, there's so much that r honestly, that God does provide us with, and I just I'm so fortunate to be able to have this platform to discuss these types of things. But yeah, while we're on the topic, I would love to hear, with you going through the Functional Nurse Academy, that's great that you found it in depth and that that you're still learning from it. How did it help you with your launch of your business?
it certainly made me feel more confident. I think being so new at this whole business and this whole process, I'm still like nervous, but I have been utilizing like your recommendations for pro bono clients and just helping some of my friends that have had a lot of issues. I'm still in the midst of helping them currently, so I don't have any like super success stories yet with them. But I think just knowing that I have like all the knowledge that you provided and all the information all in one space is super helpful for me. Um it really helped me, like, hone in on what I wanted to do because I had all these people telling me, like, "Oh, you should focus on one thing. You should focus on one niche." And I was like, "I don't wanna do that." Like, I really wanna focus on all the things. I wanna help everybody in all walks of life. Like, I don't want to just focus on people with gut health. Now, I know that that's more challenging, but for whatever reason, I've always made things more difficult for myself. But I know that I can do it, and I know that I'm willing to put in like the work and the time to be knowledgeable in all the things that I need to be.
Yeah, yeah. No, it really like it's so important. And again, like we're never gonna know all of the answers. And I know when I work with a healthcare professional, if they are just honest and tell me that they don't know the answer to something, but hey, I'm gonna go find out. I have so much respect for them than the ones that think that they know everything or will just spit out a random answer. So, but also I think that when we're working with that client population and people are sick and vulnerable, when our hearts are in it and when we really do truly care for that person and we are going to put our efforts forward the best way possible to help them, they can really pick up on that. People sense those things. And I think it is interesting. I think that your background is really interesting because you have that background in herbal medicine, which I mean, I'm just so interested in. And you also mentioned a success story using burdock root. I would love to hear, like, what is burdock root? And then how did you use it in this situation?
So, burdock root is a root, and it actually is super beneficial for cellular repair in all aspects. And that's the reason why I chose that specific root. I didn't mix it with anything else. I literally just used burdock root. I usually get my dried herbs from specific places. I particularly like Frontier Co-op or Star West Botanicals. but it's a very long process. My it's my friend. So my friend, she couldn't have babies, and her husband had tried and tried and tried for years, about 5 years. Um, and I said, "Hey, well, let me make you something." And she was like, "Okay," because at this point, she was willing to do anything to finally have a baby. And so I made her a burdock root, and it takes about 6 to 8 weeks for it to actually, brew. Like, it takes a while for it to brew, and it's time consuming, so you have to shake it every day and make sure everything looks good, and then you strain it and stuff, and I gave it to her, and she finished the bottle, and she texted me a month later and told me that she was pregnant. And at that time, I think she was, like, 8 weeks pregnant, but she ended up having a successful pregnancy, and her daughter just turned 1, and she's having her 2nd baby this month.
Aw. Oh, I love that. That's so amazing. And, you know, I really I think that herbs are absolutely incredible. And when I'm looking up burdock root, so what's so interesting in this is it is rich in so many phytonutrients, antioxidants, essential minerals such as magnesium, B6, folate. And something else that is interesting about that is when women are in their baby making years, okay, of course, we know that there is a hormonal component there, okay? Well, our hormones need to have minerals for the precursor of your hormone production. And I wonder if that may be a component there is that she was on burdock root, which is so nutrient dense. And then a lot of women, because we're exposed to all these things that we should not be exposed to, and a lot of us are super stressed, many people are like walking around with this like underlying inflammatory condition that is just flying under the radar. And if the body is super inflamed, the body and its, with how magnificent God designed the body's going to be like, oh, yeah, we're nutrient deficient and we're super inflamed. Let's not make a baby right now. Okay, that's going to be a little too much for us. But I think that's great that you provided her with something that's so nutrient dense and anti inflammatory. And then just a month later, she was pregnant. And you said that she was trying for 5 years
Yeah.
with no success. And what was her, when you were working with her, at the time, what were the other options that were presented to her?
She actually did do IVF, I think twice. Um, I think she was getting ready to do in vitro, but I gave her the burdock root and then she no longer needed to, obviously. So,
Mhm.
um, but then I also started guiding her nutritionally. So after she became pregnant, I started working with her diet control and giving her like specific foods to eat, what to get rid of, what to stop taking. Um, I actually encouraged her to get off of a prenatal vitamin because I don't believe in a lot of the prenatals. There are specific nutrients that you need when you're pregnant, but you don't need the full like prenatal conglomeration unless it's like a really good specific one. But in my opinion, during my pregnancies, I only took like folate and like vitamin C. I really boosted my immune system during pregnancy. I never took prenatals because I don't feel like they're necessary. And a lot of them have a lot of like excess chemical compounds and ingredients that we don't really need.
Well, I really love that on your website, you have a section for postpartum, women's wellness. Because again, postpartum is, like that's one of my favorite niches. I love it when you guys are really providing services for that population because they're so underserved and there's so many things we can do to help them. So,
Yeah.
want to get your feedback on this. So, okay, before I knew anything, when I was pregnant with my first child, I'm like, thank God he's okay. But I remember I was like working in the hospital. I was eating the hospital cafeteria food, which is basically, that's like the same class as jail food, or it's bad. So a lot of bad things went into my body. And I was taking basically like one capsule per day, basically a bright red. It was a bright red tablet multivitamin that I got from my OB. Yeah. So what do you think? Y with the just poor quality with, like, the dyes and stuff like that in it, why do you think that OBs, with all of their education experience, that would be a good idea to give that to a pregnant woman? Do you have an opinion on that?
I do. Honestly, I feel like, yes, OBs and doctors are educated, but they're also not educated. They are educated in what modern medicine wants them to be educated in, and they fail them, unfortunately, by not educating them in like proper nutrition, proper minerals, deficiencies in certain situations like postpartum. Um, I remember with my third and finally getting into functional medicine, it was so frustrating for me because I have to have C-sections because of my brain malformation. And um, with those C-sections come so many other gut issues, and nobody ever tells you about what you could possibly experience. They don't tell you about the diastasis recti. They don't tell you about the gut microbiome. They don't tell you about the mineral deficiencies. They don't tell you about anything. So I put that on my website because I wanted to make sure that women knew that there was a place for them to go, that I could test their minerals for them. Because I feel like mineral deficiency is a huge issue with postpartum. It's not necessarily vitamins, it's more so minerals that women are deficient in when they're going through the postpartum process.
And, the beautiful babies, I mean, I still am just in awe of this. I think it's my and I am, like, I'm definitely done having babies. Like, my 41-year-old body is like, "Do not do that to me. We're done." So I am done. Next time I get baby fever, I'm just gonna show up at home with a puppy. But anyway, so these beautiful babies are amazing, but I mean, they are really using up mom's mineral stores. And we know so many women are going into pregnancy low in essential nutrients and minerals and also with gut issues, which that further inhibits our absorption. But I like on your website that you have listed the nutrients like the ferritin, the B12, the folate, the vitamin D, all of that. Like, it's so important. And I mean, I've seen some really, really amazing things just working on people's, stress, sleep, working on their gut, getting people to actually consume like real food. And
Yeah.
um, I also wanted to ask you, so you mentioned that you, of course, do a lot of like nutrition coaching, and you mentioned before that you kind of teach people certain foods to remove from their diet. What foods do you see that you think are causing the most trouble for people?
Oh man. Um Honestly, there are so many foods. Um, I am a grocery shopping Nazi. It's very time consuming for us. Even my 9-year-old has learned to look at labels. And I think one of the main issues that are in like our grocery stores and whatnot is there's a lot of labeling that like natural flavors that is misconstrued, and like the boxes or the foods that say bioengineered. Nobody ever teaches anybody not to buy bioengineered products. I don't know how many times I've gone into the grocery store and I'll be like, "Oh, it's bioengineered," or my 9-year-old will be like, "Mom, you can't buy this. It's bioengineered." And people will be like, "Well, what does that mean?" Like, that are just randomly walking by. It's like the lack of education, um, in the nutrition world that, like, and I think one of the most annoying things is, like, the dyes in our foods and the chemicals in our foods that people are just so accustomed to buying. One of the big ones is cereal because we all kids love cereal. I know they're trying to transition that, but I don't know, food there's, like, all kinds of food. And even now, it's scary too to just buy Whole Foods because of the the farming lands being exposed to chemicals. Like, I just feel like it's scary, and I try so hard to make my own little, garden outside, but I live in Arizona, and it's 800 degrees here, so that's pretty hard to make our own fruits and vegetables outside without them dying in the heat. So
Yeah. Yeah, one thing that I like to share with people, and men and women are so different, I think that a lot of times, and again, like the primary consumer of functional medicine programs are women ages around 35 to 55. And a lot of women have a hard time convincing their husbands when they're at the grocery store, okay, no, we need this bell pepper. That's 3 times the cost of this other bell pepper. And they look exactly the same. And I do think it is important to educate people that, like, what you put in your body, it does matter. And I mean, how many times has the US government said that something is safe when they, like, have not been correct? And again, glyphosate, which is the herbicide they're spraying on a lot of our crops. There are many links to glyphosate and a multitude of health conditions, especially things like cancer. But for our listeners that are like overwhelmed about buying organic food, one thing that I really like to teach about is the EWG, Dirty Dozen and Clean 15, because there are foods that have very low, maybe even not hardly any detectable pesticide limits, like your, broccoli or your bananas, avocados, things like that. So there are things that you don't have to go buy organic. But yeah, what's another, if you're working with a family and they're overwhelmed about like having to eat healthy and buying organic, like what's another tip that you have for people to help to reduce that overwhelm?
My favorite thing to do for people is just tell them to remove one item at a time. It doesn't have to be an immediate, like, you have to do all of it at once right now, because it does become overwhelming, and it's frustrating, and it can be very expensive. So, I like to tell my clients, like, "Well, let's see what you have in your fridge or in your pantry, and we'll start with, like, the worst product for you, and let's remove it and replace it with something else." And do that, like, once a week, so you're removing and replacing one item at a time, so it's not overwhelming, it's not too expensive, and it can become something, um like, habitual that they can do. Like, "Okay, I'm gonna make this a habit where I remove something bad and replace it with something fresh." And usually when I have people come to me for, like, nutritional help, I provide them with a healthy swaps list, so that they can just go through that list themselves and swap out the things that they need to on the time frame that they want to.
Yeah, I love that. And again, like I think that nurses, we're good at reading the room,
Yeah.
And we know that if people are getting like real overwhelmed, it's better to do baby steps than for them to get so overwhelmed that they quit. And then also like I think getting people to hang in there long enough to where they start to see results, because I think it's challenging at first when they have that doubt, like, okay, I'm going to do all this work. It's not going to work. But when they start seeing results and then they're like, wow, this is real. Like my husband, who we have those conversations about having to buy the more expensive bell peppers at the store. And he thought it was so silly. And now he is sold on this just because
Yeah,
we have seen so there were like so many random issues that we dealt with that are completely gone. And then
yep.
he's seen my transformation, like healing from, chronic Lyme. So it really like yeah, it's amazing. I mean, that is something that like our family will spend money on. Like I get my hair cut like twice a year. I don't own a tube of nail polish. Like I just don't spend money on those types of things, but
Yeah,
we will spend money on
on food.
nourishing foods. And again, like I really think that it is the best investment that you can make is in your health.
Yep.
So, well, I would love for you to tell us where can our audience go to find you and learn more about what you do?
I do have an Instagram account. It is Cassidee Weaver Functional Wellness. Um, I think I think that's what it is. I'm really bad at social media stuff. I don't
I hate
know.
social media, like, I really hate
Same.
it, guys. I will put that oh, I found you. Oh, and your picture looks super cute. Okay, I found it. I'm gonna link this in the show notes.
Okay. And then you can also my website is www.fmpwellness.com.
Okay, great. So I will link that in the show notes, and I also see that you have a guide that you created, which is your okay, Cassidy Weaver's homeopathic book. I love that. Can you tell me about that?
Yeah, I wrote and designed a children's like homeopathic first aid book.
Mhm.
It's on Amazon too. Um, but I always had people come to me for like children's health, and I have kids myself, so it was kind of just something fun that I was doing while I was in limbo of like my education, where I was just studying on my own and doing all these like alternatives for my children. And so I decided to write a book, and it's like a little, I think it's 101 pages, and it's just got a bunch of different, um, like traditional things that kids go through: bug bites, colds, viruses, flu, stomach issues, constipation, hand, foot, mouth, traditional children virus and issues. Just a treatment plan, options that you can get, homeopathic medications you can buy. I even have like homemade recipes in there that I've designed and used on my own children. Um, and it's got like a little Christian coloring book at the end for kids to use and paint or color whatever they want to do with it. But it's just something fun that I wanted to make. It's very colorful, it's bright, it's cartoony. So it was just a little hobby that I was in, and um I wanted to put it somewhere else where everybody could see it. I have a couple of friends who've bought it and love it. But I don't have paper copies right now, but if you buy it on Amazon, there are paper copies that you can buy there.
Okay, cool. Yeah, and I'm like glancing through your social media. You got a lot of good content on here. This is amazing. And you being, I always like to ask this question because I know everyone's access is different. So, are you seeing clients multi-state, or are you just working with clients in Arizona? How does that work?
I do right now. I see clients just virtually, so I am anywhere, multi-state that my license is in. And I want to eventually get a clinic, like an in-person place, because I know a lot of like older people like to be in person, which I understand. So once I'm done with my program, my goal is going to be to try to find somewhere I can rent for now until we move, so that I can see people in person.
Oh, that's wonderful. Well, it was so great to have you on. Like, it's always just, I just love to chat about these things. It's great to be able to meet my graduates in person too. Well,
Yeah.
not really in virtual, but you know what I mean.
Yeah. Yeah.
So, well, thank you for coming on. And to our listeners, I will be posting all of Cassidy's links in the show notes. So be sure that you check out her work. She's really just doing God's work. And I just think it's so amazing. All of the people that she is helping. And that is all the time that we have today. Thank you so much for tuning in. And again, if you want to learn more about the Functional Nurse Academy, please feel free to register for our next live webinar, and you will see that link in the show notes. You can also check out Functional Nurse Academy on our social media platforms or on our website at functionalnurseacademy.com. Until next time, be safe, be well, and God bless.